The first Omicron case has been officially detected here in the U.S., and Texas is preparing. Previously, the Department of State Health Services depended on the CDC for its virus sequencing. But this month, the state is beginning to conduct its own sequencing to analyze which variants are already here. Maggie Glynn gets an inside look at the state's lab and how it will benefit our response to the pandemic going forward.
While the state awaits more information on the latest Omicron variant,
We think that it could already be here,
DSHS is increasing its sequencing efforts.
and it's just a matter of detecting where it is.
In a partnership with the University of Texas's School of Public Health, the state will be able to increase its sequencing by 25%.
COVID samples get sent to the virology team for extraction, and then the RNA gets delivered to us, and we start the sequencing.
The process starts with samples from PCR tests and makes its way through a 3-day analysis.
What we do is look at each part of that genetic sequence, and we can look for changes. So we know the original one that came out in China, and we know then the changes that have happened since then.
The new partnership also gives Texas more control over where the state will pull the samples from.
So CDC has done a fantastic job of really trying to sample all across the United States and getting a good number from Texas. When they use their contract labs, though, we don't have the chance for input on really where that sampling across the state is happening.
That's important given the state's size. Central Texas, Region O, for example, has a relatively low COVID hospitalization rate sitting just below 3%. But in the Panhandle right now, Region A, they're reporting an 18% COVID hospitalization rate.
We have a lot of small towns in our community that refer patients to hospitals in Amarillo. And with that, then we just aren't able to accept all those patients that need to be transferred.
And we want to make sure that we will be able to recognize when a variant pops up in El Paso, even if it's not over in Tyler.
Maggie Glynn, KXAN News.
The funding for the partnership is coming from the feds, funneled through the CDC through May of 2023.